Hi, I'm Dr. Daniel Williams with the Men's Health Podcast at accessrx.com. Today I'm going to talk about impotence treatment. Let's first of all define what we mean by impotence. Impotence is kind of a broad term, but what it means is either the partial or complete inability to achieve or maintain a satisfying erection. Okay, so that's a big scale. It can be from just a little bit of maybe you can't maintain an erection long enough to satisfy you and your significant other, or to complete flaccid paralysis. There's no erection whatsoever. There can be many different types of causes and reasons why somebody can become impotent, and it's important to know the exact definition because it can have huge health implications. Okay, there's neurovascular causes. They can be congenital or traumatic in nature. It's possible that even systemic chronic diseases such as diabetes and hypertension could lead to a problem such as neurovascular problems in the pelvic region that would lead to impotence. There's also direct cardiovascular problems too. If people are having cardiovascular atherosclerosis, arteriosclerosis, that could happen. And it would be important to know about because that could also be an early warning signs for things like strokes and heart attacks. And then finally, there's the whole mental category, psychogenic as it's called. That is stress, performance anxiety, depression, other things can contribute to impotence as well. So of all these different causes, vascular causes have the most success with medications. So let's talk about those for a minute. First of all, some statistics. More than half of men ages 40 to 70 have reported to have erectile dysfunction to some degree or another, even in the most severe cases. And these guys are experiencing relief with erectile dysfunction medications such as Viagra, Cialis, and Levitra. So the vast majority get relief. The next statistic is 41 to 65% showed satisfaction. So it's actually a clear majority of men, even those with the most severe cases of erectile dysfunction, are, by at least 2/3 of them are saying that they are completely satisfied with their improvement in their satisfying erections. And the last statistic for you is that we know that at least 58% of men with erectile dysfunction symptoms are not telling their doctor about it in their clinic visits. These are based on large international studies, all of these. And it's important to know the reasons why a man wouldn't tell his doctor about erectile dysfunction symptoms. One of the big reasons I can think of is embarrassment or minimization, that it's not that big a deal. Maybe you expect that with age or something, and so you've justified it for a while. But it's important to bring up with your doctor and let them be the judge of that, because it's possible that it could be a sign of a systemic illness and something that you may need treatment for, even if you don't have that much of a sex drive, not all that interested in sex. If you're unable to perform, it's important to let your doctor know. So if you have a little trouble bringing this up with your doctor, maybe you're embarrassed or you haven't told your doctor, don't have one nearby, you can go to accessrx.com, and if you'll place an order for Viagra, Cialis, or Levitra, one of these erectile dysfunction medications, right after you place your order, you'll be prompted to provide a complete medical history, and a U.S. licensed physician will review your history and consider writing a prescription for you. So it's possible to get Viagra without leaving your house these days. Pretty convenient, and maybe we can improve those numbers of these 58% of men that aren't telling their doctor about it. Okay? So I'm Dr. Daniel Williams with accessrx.com.